Welcome back, everybody. You are looking live inside the Fox 35 studios. Joe Bert is here with me on the curvy couch. He'll be along to talk HSAs in just a bit. On the Money Watch this morning, are you leaving money on the table when it comes to your health? Well, you could be when it comes to your health savings accounts. Certified Financial Planner Joe Bert is here to talk more about it. Joe, good morning to you.
Janelle, good to see you.
The first thing Joe asked me was, do you know what an HSA is? And I happen to know because my mom has been on me, as I told you, about the HSA.
Your mom's a smart lady.
Okay, so talk to me about why. What are HSAs, first of all, and why are they important?
Sure. HSA is a health savings account, and they came about as a result of the high deductible plans that employers have today, or individuals have today. If you have a high deductible plan, it's $1,350 for an individual, $2,700 for a family. So if you have that kind of plan, the government says, we're going to give you a little bit of break to pay for your medical care that your high deductible doesn't cover. And what you do is you write a check to your health savings account, and it's tax deductible. So just like your IRA 401k is tax deductible, it stays in the account and it's not taxable while it's growing, and when you take it out to pay medical expenses, it's totally tax-free. And that's the beauty of it. So, but unfortunately, many people don't use it.
And I think the other thing that maybe many people don't know, Joe, is that your boss may actually give you some extra money to have an HSA.
Yes, some cases, employers that have, in our company, we do the same thing. You give your employees some money to put into their HSA. It's not taxable to them. It's tax deductible by the company, and it's a kind of a win-win situation. The key to making this work for you long-term, Danielle, though, is to have that money invested. A lot of HSA plans today, unfortunately, they take your money, they put it in a low-yielding money market account, doesn't get anything. Go to hsasearch.com. hsasearch.com. And there's all kinds of options on there, and you can invest the money long-term. Now, the real key is, if you could put the money in your HSA and not use it for medical expenses, and then when you get to retire, if you've saved your medical expenses, your receipts over all the years, you can then take the money out totally tax-free. So it's like a Roth on steroids. It's a great plan. Now, many people use, of course, the HSA monies for your dental expenses, your eyeglasses, prescriptions, and the deductible on the doctor, which is fine. But if you can afford to let it grow in that account, it's a tremendous plan.
So let's bring this all back home then and kind of wrap it up in a nice bow for our viewers out there. The benefits of an HSA, why is it important? Because you are going to have people who are going to be watching this and say, oh yeah, that sounds nice, but they may not want to take that extra step to actually do it. Why is it important that they take that extra step?
First of all, because it's a clean tax deduction, no question about it. Secondly, the money will be in the account totally tax-free, and when you take it out, it comes out totally tax-free if you use it for medical expenses. And once again, as I said, when you retire, if you've accumulated a lot of receipts of stuff that you haven't paid for.
So save those receipts.
Save, that's the real key.
That's the key,
and you can use it to pay your Medicare. So it's a wonderful plan. There's $3,400 for a single, $6,900 for a family, and if you're over 55, you get to put an extra $1,000 in.
All right, so I've got to listen to my mom.
There you go. Your mom's a smart lady. There you go.
Joe, we appreciate you.
Danielle,
thank you. You have a good Sunday.
You too. Good to see you.
I appreciate you. Thank you.